I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
Welcome to this episode of IDD Health Matters. Today, our guest is Kirsten Sanchirico. Welcome, Kirsten.
Thank you.
Tell us a little bit about yourself, how you got into this field.
Well, I worked for the New York Alliance for Inclusion and Innovation in Albany, New York for the past 8 years, which is a not-for-profit organization that supports providers who support those living with IDD. And prior to that, I worked for a not-for-profit organization actually supporting people with intellectual and developmental disabilities for many years, and wore many different hats, and actually started out as a direct support professional when I graduated from college. I was interested in getting my master's degree, and when I applied for the master's degree, I was told that I needed more experience in the field. Even though I felt like I had lots of experience in social services, I didn't have a lot of experience directly working with this population. So I went out and got a job working as a direct support professional. And I really fell in love with the job immediately, but I also felt very frustrated by the way the services were being provided in the organization. And that, I think, piqued my interest in staying in the field and working my way up into an organization where I could impact change for the services that were being provided. I grew up in a social service family, so both of my parents and their partners are ordained ministers. And so I've worked in and lived in a human service profession the majority of my life. I think that's what inspired me to feel a passion for working with people and supporting people. I don't know what actually drew me to this population, but I just felt that they were underserved and marginalized in a way not many others in the human service sector are. And so I think that's what drove me the most.
So one of the reasons that we were doing this podcast is really to help people understand that you can work in this field, and there is a career path in this field. And I've heard from a number of people that talk about how they started as a direct support professional. So that's pretty neat and pretty interesting. Let's talk a little bit more about that. What was it like for you as or coming into this field as a direct support professional? What was your day-to-day activities like at that time?
I worked in a day habilitation program. I was supporting people who had a lot of support needs. And at that time, in this particular organization, it felt to me that they were preparing folks to go to a workshop, to prepare them for some sort of job, which in this organization was a workshop where they had contracted tasks. But the people that I supported weren't probably likely ever to get to that workshop. They had some pretty significant challenges based on their experiences in life. And so to me, that was frustrating that we had one path for folks, even though likely they wouldn't actually get to that path. But yet we were still encouraged to teach the skills that were going to be utilized in the workshop. So I spent a lot of time, especially with one woman who was blind and also didn't use words to communicate. And we sorted silverware into plastic sleeves over and over again, day after day after day. And she expressed her frustration, but it didn't seem that people were really listening at the time. And that's what really inspired me.
So what have you seen change since then related to that in terms of maybe choices that people have?
I think the opportunities have opened up for the understanding within organizations that one path for all is really not appropriate nor achievable.
It's not really appropriate or achievable for anyone, is it?
No.
Right. And we all want a little bit of choice to do maybe something that interests us in our lives, right? And it's the same for people with intellectual and developmental disabilities as well.
Absolutely.
Yeah.
And I think ultimately, even though this organization was pushing folks towards a workshop, there really wasn't the belief that people with disabilities had the opportunities that we all have in life and the choice to choose employment that they preferred. And so that same organization that I worked at I left that organization, but ended up going back many years later as the leadership changed to start appreciating folks for who they were as individuals and imposing person-centered supports into their practices and really allowing people to experience life in a different way.
So what was your role when you went back?
I was, I forget what the title was, I think program manager or program director. I oversaw about 8 group homes, including the supported apartment programs, and just, really ensured that staff was in place, that people's needs were being met, and that the basics of life were being offered.
Ensuring staff were in place, probably one of the more challenging parts, I bet, at times. And I'm sure there were probably times where you ended up having to fill in because you couldn't find anyone else. Right?
Many times. I remember one Valentine's Day, there was a snowstorm and roads were closed, and I had a 24-hour shift because I couldn't find staff.
Wow, that's one of the many challenges in this field. But sometimes challenging positions can also be very rewarding as well. So I know for me, many different things impacted me in positive ways in the work that I've done in this field, and I'm sure you probably have a story or two about a particular situation, maybe, or a particular thing that happened that had an impact on you.
I think really, as far as a manager supporting the staff who worked in these organizations, in these positions, I really felt it was important to treat everybody the same. So not only the employees, but also the people who were being supported in the program, and recognizing that we all have challenges and we all have circumstances that guide us in our day practice, and really connecting people to one another to support each other.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So you mentioned that you work for New York Alliance for Inclusion and Innovation, which is where we were at their annual conference this year. So talk to us about what you do in this organization. Tell us more about the organization itself and maybe even a little bit about this conference.
So my role at the New York Alliance is to support the workforce. So my title is Vice President of Workforce Advancement, and I support contracts that are funded by the state to really enhance the learning opportunities for direct support professionals and frontline supervisors and administrators. It's called the Regional Centers for Workforce Transformation, and it's one of the only projects that has been funded by New York State that really gives for free to providers. And our challenge is to encourage and to support providers to understand the benefit of these free resources. Oftentimes they're imposed with mandates that are unfunded and create more and more challenges. Our resources, really enhance the work that they're already doing. And we're encouraging folks to understand that for your staff to really retain your good staff, you need to do a little bit more than beyond the basics of mandated trainings. And so we supplement all of the resources that they can provide to staff.
You know, I like the fact that you touched on the importance of staff training and going beyond just what's mandated, because from my perspective, I had essentially no training in my health professional program about providing healthcare for people with intellectual and developmental disabilities. And when I started in this field, it didn't take me long to recognize that. And it makes you feel uncomfortable when you are responsible for recognizing, say, health destabilization as one of the many roles that a direct support professional has to do. So training people for those roles is extremely important. And from my perspective in the healthcare world, I'm always thinking about ensuring that every level of supporter, every supporter role understands that there are different ways that people might present with underlying health conditions, and it might look like some adverse behavior. And rather than just saying, oh, well, this is due to the fact that they have a disability, many times it's going to be due to maybe something that's causing discomfort or pain or some environmental circumstance or whatever it is. And it's really important that staff are trained to be able to recognize those changes in a person as being important indicators of something that might be treatable or fixable.
Yeah, I love that you said that. My other role at the New York Alliance is as a certified trainer for person-centered practices and person-centered thinking. The New York Alliance has also allowed me to take on another role, which is to be the executive director of the learning community for person-centered practices.
Wonderful.
So my role at the New York Alliance really brings together a lot of the feelings and the thoughts I had as a direct support professional. One, that the staff need to be well trained. They need to be given feedback and supported to grow in their roles. And also that in our roles, we need to be person-centered, not only supporting the people that we are working for, but also the employees that we're working with.
That's a great point. Would you say in your experience that training staff to do their jobs well helps staff to maybe stay in the position longer and feel more a part of her job? Because, one of the challenges is the turnover of staff in this field. So do you think training impacts that?
Oh, tremendously. And I think it goes beyond training. It goes more into coaching and supporting employees to really understand what their roles are. The people that they're supporting have complex needs. Not only are they people who are navigating lives, but they also have a history of challenges, experiences that impact
traumas.
All of those things. And when you sign on to be a direct support professional, it's a really difficult and challenging career. You're not only, doing the work of a nurse or a healthcare worker, but you're also supporting someone to achieve their individual goals. And so it's really important for us to provide the skills needed. And we have realized, and our mission at the regional centers through the New York Alliance and OPWDD is really to enhance the learning. That if you enhance the learning, that people will feel valued, they'll feel more confident in the work that they're doing, and they'll want to stay.
Those are all great points. One of the things that I like to do here is something I kind of call 3 and 3, and I don't hold to it, the 3-minute part of it. But in 3 minutes, can you tell us 3 things that you think listeners, that you'd like listeners to learn, to understand, to know about this field that can improve any aspect of it? Health and wellness, integration into communities, seeing it as a career path, whatever you want to talk about. But three words of wisdom from your experience that you'd like to share with the listeners.
There is a career path, and I think we're working on that career path to include folks who want to stay in the position of actually directly supporting people with developmental disabilities. I've learned more from the people who I've supported than probably many of the staff that I've worked with.
I understand. I understand that as a physician. I've learned a tremendous amount from the people that I was providing, healthcare for, as well as the staff. It was quite eye-opening and an interesting experience.
I think just at the end of the day, you can come home and know that you've impacted people's lives in a meaningful way. And the people who I share the roles with, my colleagues, are also some of my best friends. We spend a lot of time together caring about people, dealing with challenges and loss. And so the bonds that you develop with people that you're working with is also a valuable experience, I think, different from other workplace settings, because you're really just dealing with people in an intimate and private way, and so that bond that you create is very impactful.
So what else would you like to share?
Well, I just love what I do, and I know that, many of my family members might be doing different things in human services and supporting people in different ways, and they might be working in for-profit organizations where they're making a lot more money than I might be making. But at the end of the day, I just really feel a passion for supporting people. So I think it's the combination of what you receive from the people that you support, what you receive and mutually give back to both the people you support and the staff, and making a difference in people's lives.
This field pays us in more ways than just money.
Oh, absolutely.
Yes.
Absolutely.
Personal satisfaction and knowing that what you're doing is meaningful and important to other people.
I mean, I grew up as a PK kid, so preacher's kid, and I never dreamed of myself as being a millionaire or rich in any way. I always envisioned myself as giving back and being comfortable, and I have been comfortable. And I think there are lots of opportunities for people in this field to grow. It might not look the same for everybody, depending on what your talent are. I think that's another benefit of the field, is that there's so many different jobs and roles. It's not just, one thing for everybody. There's many aspects to the service and many different talents involved.
Kirsten, thank you so much for being a part of this podcast today and sharing the wonderful stories and your experiences in this field, and helping people see this as a place that they can have an impact in other people's lives and earn a living as well too. And also thank you for the work that you do.
Thank you very much. It's an honor for me to be able to do this work.